Okay, for this week's video we're discussing a cold call we went on about PRP to one of our surgeons. Basically I went to this guy, Dr. Katzman, who I have worked with before. He has offices in Brooklyn, Queens, and Long Island, and then both Nassau and Suffolk counties within Long Island. He sees a ton of patients. The vast majority of them are workers' comp and no-fault patients. He runs a practice where he is extremely concerned about making money. That's what his goal is. He's not so much concerned with trying out experimental things like PRP to whether it's going to work or not work. If he could make money off it, that's where I was able to draw some excitement in him, because he had never heard that before. As far as he's concerned, you don't get reimbursed for it. However, one of the things we have going on right now, one of Nick's doctors, Dr. Baum, is using PRP for his no-fault patients and is extremely confident that they will get reimbursed for it. If we see those results come back positive, it will have huge benefits to many of us, obviously. And when I passed this information on to Dr. Katzman, that was something that he became extremely excited about and was really where I was able to take the conversation. He wants to make money. He already has an ultrasound machine in his office. If he could do ultrasound in conjunction with PRP and make money off it, I mean, he's like, Jason, I'll be injecting people's feet, elbows, and you name it, I'll be putting it in there. I mean, I was able to draw, like, the smile that came across his face was actually somewhat comical. But, moving forward, that's kind of what I'm relying on. Hopefully that this Dr. Baum will be getting reimbursed at least for the majority of his cases. And we can pass that coding on to different doctors, and hopefully it will be extremely beneficial to us. Like I said, he's not gonna use it if the office has to eat the costs and his patient population is not such of that will be paying out of pocket. It's just not going to happen. But moving forward, he is extremely busy, and I think there will be somewhat of potential here, or a lot of potential, if we can learn a little bit more about reimbursement and be creative in how we relay that message to some of our surgeons. But in the end, it's going to be about money for this doctor, as it is with many of the doctors in at least this area. The patients don't have the money to front it. It's not quite the city demographic. But moving forward, I look forward to seeing everyone else's video. Good luck. Have a good weekend.